Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Of course, we have another excellent show for you today. We're going to be talking about breast cancer, and we have the perfect person to cover this topic. But before we cover that topic, I'd like to thank each and every one of you, all of you that have emailed me, that have tweeted me. I really appreciate it. And keep it coming, guys. I want to know what you're thinking about, what your health is like, what your med moments are that made you think that you needed to go to the doctor. I want to know so we can do what we need to do so that you can learn more from our show. That's what it's all about. Now, as far as breast cancer is concerned, I have Dr. Alice Cohen, and she is Director of Oncology at Newark Beth Israel Medical Center. Dr. Cohen, welcome to our show.
Thank you, Dr. Bey, and thank you to your viewers for allowing me to have this opportunity to discuss breast cancer with you and answer all of their questions so that this is another learning moment for them.
Oh, thank you very much. So I'm going to start off with my number one question. I always ask everyone this question. What is breast cancer?
Breast cancer is a malignancy. By malignancy, I mean that it is a tumor that grows out of control. And that tumor, which is breast cancer, begins in the breast. It can grow not only in the breast, but it can spread other places, and that's what our concern is, and that's why people are so frightened about it and need to do something about it to either prevent it, diagnose it early, and find that early treatment so that we can prevent breast cancer from harming individuals.
Okay, let's just step back and just get a little more detail. Cancer itself, is it a normal cell or is it an abnormal cell? What's the difference between a cell that's, normal breast cell and a per se cancer breast cell?
Right. So normal cells have a life cycle. They begin and grow and divide, and they eventually stop growing. When I first began to learn about the difference between cancer and breast cancer, cancer and normal cells, it was because cancer cells are cells that never die. They keep growing and dividing. And an example of something that's a normal cell might be that we start growing different parts of our body. Our fingers start tiny and they grow big, and eventually they stop growing. The normal cells know to shut off. A cancer cell is immortal. It never stops. It keeps growing itself and it keeps dividing, making children and more children, and that becomes a tumor, a cluster of cells that keep growing and growing, never knowing when to stop.
Boy, oh boy. Now, talking about breast cancer, is it always in the same part of the breast, or can it be in different areas of the breast?
A cancer in the breast can begin in any area of the breast. That is, it could begin on the outside of the breast, it can begin deep inside the breast, it can be under the nipple, so it can be located anywhere, and that's why it's important when we're screening and looking for early cancers to be sure we look at the entire breast.
Okay. So a patient should, if they see something abnormal, or if they feel something abnormal, then they should go and see their doctor, and because it could be anywhere or any size.
Absolutely. Any change from your normal pattern, if you look in the mirror at your breast and you see something that looks different, if you take a shower and you're washing yourself and you feel something that wasn't there anywhere in the breast, it needs to be brought to the attention of a physician or a healthcare provider. It may not be cancer, but it still needs to be evaluated.
Okay, so we're talking about things as little as like a rash, or something like a little pimple on the side, or you may not feel anything, but it may just be pain, or something like that.
So it could be pain. You could see a change in the color of their skin. You could see dimpling of your skin. You might notice actually a lump or a small ulcer on the skin where the skin breaks down. And finally, you could see some discharge coming out of the nipple from the breast, a liquid that comes out that wasn't there before. Not, for instance, if you're not breastfeeding and suddenly there's either a clear liquid, a white liquid, or even blood coming out of the nipple, these are all warning signs to watch for.
Excellent. Now, There are different types, I'm sure, of cancer that affect the breast. Can you just give us the different types and what we should look for with those
Sure.
types?
Most breast cancers are what we call carcinoma. They're tumors that arise within the breast itself. And the most common type of breast cancer is what we call ductal carcinoma, because the breast is a big gland and it's filled with these little ducts. They're milk ducts. They make the milk that we feed our babies with.
Right.
And within those ducts there are cells that can become these malignant cells that suddenly start to divide very rapidly. That's called ductal carcinoma, either invasive or non-invasive. And then
Now, when you say invasive, that flew over my head here.
Okay.
Tell me what that means.
So in the very beginning, when a cancer begins, it's within the duct and it stays there. And we call that non-invasive ductal carcinoma. Once those cells divide, they can start to break out of the duct into the other parts of the breast. They're surrounding fat, they're surrounding other tissue, also known as lobules, different parts of the duct, and it could invade into that. There's some cancers that start not in the duct. They start in the lobules, which are around the ducts, and that's called lobular carcinoma. So those are the two really major types of breast cancer. Of course, once in a while, somebody gets an unusual cancer in the breast that's not a carcinoma. Occasionally, we'll see people who have a lymphoma, which is a tumor of the lymph system, and that can be in the breast, or something in the muscle around the breast, what we call a sarcoma. So these are very rare tumors of the breast, but they need to be evaluated for.
Alrighty. How do patients present? Like, what's a typical patient that would come to your office and you would find that they have breast cancer? How do they present to you usually?
Yeah, there are two major ways that we find people have breast cancer. One is, again, somebody notices a change in the way their breast looks, or they feel a lump, or they've gone to their doctor for a regular checkup, either their gynecologist or their primary doctor or any other specialist who examines the breast, and they feel something. It could be as small as a tiny pea, or it could be a larger lump. So by feeling it is the first sign often of women thinking they might have something wrong with the breast, and a doctor will refer to us for further evaluation, or more commonly to a surgeon to evaluate that lump. The second way, however, is to find it by screening, and that is done usually with the screening mammogram. A mammogram is a specialized X-ray that looks at the breast tissue deep below and can see changes, either calcium in the breast or actually lumps in the breast that are highlighted by real bright lights on the breast X-ray, and that is one of the most common ways we find early breast cancer.
Okay, all right. Now, as far as the actual, I know that I've heard that you always will tell a patient that they should do self-breast exams. How do you learn how to do a self-breast exam, number one? And number two, how often should you do them?
Right. So I am a big believer in self-breast exam. You might be watching TV and hear a bit of controversy that's been happening over these few years. Should women examine their breasts? But I still think it's one of the earliest ways for women to find that there's something different and bring it to the attention of a physician. So in general, we like to start teaching women to do self-breast examination actually in their teenage years. And we've gone out to train pediatricians and primary care doctors to begin to teach patients to examine the breasts. The best time to examine the breast is after your menstrual period is complete, so the breasts are less swollen, and often I recommend doing it in the shower because you're in a standing up position and the skin is very smooth and easy because it's wet. And we have little education cards that we give to people, so even though we show them in the office, they're going to go home and say, what am I going to do? And we have little picture cards that can teach you how to examine your breasts in a regular fashion. The main thing is, when you do breast examination, it should be regular, so once a month, right after that period, and that you do it exactly the same way so that you get used to the way your own breast feels, and eventually, if there would be something abnormal, you would notice it.
All right. Can breast cancer occur in men?
Yes, it can.
Okay.
About 1% of the breast cancers do occur in men. And it really is not that men would have less risk. It's all related to how much breast you have. So men have very little breast tissue,
Right.
and therefore there's very little tissue at risk to get a cancer, where women have larger breasts, so it's much higher risk to develop a cancer.
Alrighty. And is the life expectancy or the severity of the cancer different as opposed to women or men?
Not really, but of course men are not often looking for breast cancer, and even their doctors are not. So
Right.
often we find them a little bit more advanced than early on, and so prognosis, the likelihood of being cured or getting that treated early, really depends on finding it early.
Right. Now, I know, is there any types of cancers that can just disappear or not? Like it can come and then, you can kind of get rid of it on your own, or is it always that you have to, get significant treatment, either surgery or chemotherapy or whatever for
Right.
these particular type of diseases?
Right. So once we really make a determination that it's actually cancer, as you recall, I said cancer cells are immortal and
Right.
they keep growing and dying, and they don't stop growing if it's truly made that genetic change to cancer. So leaving it will eventually cause you a problem. Some cancers grow more slowly than others, and we've sometimes unfortunately seen a woman where it might not have been found early enough, and it took about 2 years till it was found, but it still had not advanced or grown very quickly.
Right.
And other women we will see it grow and double in a few months' time.
Okay, alrighty. Once you know you have the lump there or a change in your breast, how do we diagnose the cancer itself? Where do we go next as a physician or a patient to truly get the diagnosis?
Right, so once we either find a lump or we have an abnormal mammogram, the next step is to sometimes do an additional type of x-ray test. So if we're not really sure that it's malignant yet or a cancer, we'll do an ultrasound to get a better idea of how big it is and the consistency of it. But eventually we need to do a biopsy.
Okay.
And that is putting a small needle in to the lesion that we feel or something we see on a mammogram under the mammogram machine, and we take a biopsy and take it to the pathology, the people who read these biopsies, and look at it under the microscope and make the diagnosis.
Okay, alrighty. Now, just stepping back to mammogram again, how often should someone have a mammogram?
Right. So again, another little bit of area of controversy, and actually different countries follow different guidelines, and you've probably watched the TV, people are screaming and yelling again, should we really have mammograms? Are they cost effective? Are they not? We tend to really follow the American Cancer Society guidelines because it really does pick up the cancers most commonly, and a little less worried about the cost involved, because ultimately if someone has cancer, the cost is going to be much higher if we don't treat it.
Sure.
So that guideline is that we recommend that in general most women should have a screening mammogram sometime between the age of 35 and 40, and then begin to have mammograms every 1 to 2 years between the ages of 40 and 50, and every year after 50. And we continue that for the lifetime of women unless they have some other condition that would say we don't want to keep screening anymore. So age alone is not the cutoff.
Alrighty. So I was going to ask you about age. Is there one particular age that you see breast cancer more than another? Like, is it more common in the elderly than teenagers?
Yes.
Give me a sense of that as
so
far as that's
breast cancer
concerned.
is much more common in women over the age of 50. So after they've completed their menopause, it is more common. But the incidence keeps rising with every decade. So it's more common in women in their 50s than 40s, and more common in women in their 60s than 50s. And it keeps rising. So that's why I say we really never have to stop screening, because the risk continues to rise.
Increase.
We do, unfortunately, see women sometimes younger than 50. Of course in the 40s, because we already know we're screening. There's a reason for that. It is still common in 40s. It is much less common in women under 40, but not unheard of. And we've even seen recently, unfortunately, a woman who was 23 years of age diagnosed with breast cancer, which is quite rare. And it is extremely rare in childhood.
Okay, all right. High risk. What makes you high risk for cancer, or this particular type of cancer?
Yes. So the most common risk factor for cancer is having had one breast cancer before. So if you had breast cancer in one breast, your other breast is at very high risk. Number 2, a family history. Particularly if your mother or your aunts or your sister or your grandmother had breast cancer, that increases the risk. There is an inherited predisposition to breast cancer.
Right.
And then there's some less common categories, but some medical conditions that might have had treatment that might increase your risk of breast cancer. So we are now seeing survivors of childhood cancer. They may have gotten radiation for that cancer. Having had radiation as a child will increase your risk of breast cancer.
Oh, goodness gracious. Now, what about race? Is there a difference as far as race is concerned?
Not really on the incidence, but we find that different races may have different types of breast cancer in terms of what we call receptor status, which is looking at what might have been the trigger. So we see women whose tumors actually respond and grow to estrogen, and most breast cancers in a sense do that, but some tumors actually have a receptor, and if you gave estrogen to that patient, the tumor would grow. And other women don't have that receptor, and that really makes it challenging in terms of treatment and management, and sometimes those tumors are different based on race.
Okay, all right. What about things like nutrition? Does that play a part as far as this particular type of cancer?
Yes, actually we know that fatty diets can increase the risk of breast cancer, and we really began to realize it because the incidence of breast cancer actually was lower in Asia than it was in Western Europe and the United States. And it wasn't really race, but it turns out that their diet had very little fat. It's rice and fish and vegetables, and not so much fried foods. And when those families started to migrate and move to Western Europe and the United States, as you looked at the different generations, their breast cancer incidence began to rise. And it was really felt to be the diet, change in diet.
Interesting, interesting. How do we prevent it? How do we say, okay, I know that I may be increased at as far as getting breast cancer, what can I do to prevent this from happening to me?
Right. There isn't a whole lot, but there are a few healthy factors that can help prevent. Exercise, number 1. There is definitely now many studies out showing that exercise, aerobic exercise, 30 minutes at least 3 times a week, brisk walking or running or even swimming will reduce the incidence of breast cancer. Again, we don't have a lot of hard data, but we're starting to see more data about eating Mediterranean diets and reducing the risk of breast cancer. So those are the few things that we can do. There are no preventive medicines or vitamins that we know about that can do that.
I was going to ask you, can I take a particular vitamin that would protect me?
We don't have any data that would tell us that.
What about as far as, I know alcohol plays a big, it does a lot to the body and so many diseases it causes. Does it affect breast cancer as well?
Okay, so maybe alcohol could increase the incidence or it could protect. And actually there's back and forth talking about this. If you drink a little bit of alcohol, it looks like it might protect you from breast cancer, but if you have more than 2 drinks a day, then it increases the incidence of breast cancer. So it's a little bit of a balance there, but I think we can say small amounts of alcohol may be protective, while a lot would be detrimental to you.
While we're on that, not that particular topic, but things that may cause, what about smoking? Smoking cigarettes? So
smoking can cause many cancers. It is not very strongly linked to breast cancer, but of course can increase the risk of lung, pancreas, bladder cancer, many other cancers. And so we really advise, in terms of healthy living, smoking is not a good thing. We don't have a clear link though to breast cancer.
Okay, all right then. Obesity.
Yes.
That's something that, within the United States, we have a tremendous problem at this particular point. Does that play a factor in this particular disease?
It probably does, again, because maybe for several reasons. Again, because people who are obese may be eating that fatty diet that may also increase the risk of breast cancer. Sometimes the obese patient is not diagnosed as early because it's hard to feel the tumor or to screen well. So there are issues related to obesity that way. So we don't have a clear 100% link. Everyone obese is going to get breast cancer.
Right.
But it's, again, part of the equation.
Okay. Looking at, now that we know that we have a positive biopsy, what are some of the stages? I know usually in cancer itself, we would like to stage it and try to figure out what to do from the stages. Could you give us the stages of breast
Sure.
cancer? Just
Yes.
basics.
Yep. So staging is important for two reasons. One, it helps us with the prognosis, how well you're going to do with whatever treatment you have.
Okay.
And number two, it's going to help us select the correct treatment. So it's extremely important.
All right.
And with many cancers, in general, we have 4 stages. Actually, breast cancer has stage 0 as well.
Oh, okay.
So stage 0 is that non-invasive breast cancer I mentioned before, where there's just a few cells within the duct or a few cells within the lobule, and it hasn't invaded into any other part of the breast or
Right.
into the blood vessels. And that's as early as we can find it. In general, we don't feel those. Those are the ones that are picked up on the mammogram. And we want to find those because they require very limited treatment. And then stage 1 would be a relatively small tumor in the breast, and that's the only area it's located in. Stage 2 would be if some of those cells spread out of the breast into the lymph nodes. Lymph nodes are often found under your arm on the same side of the breast, and they can get some cells into it. That's the first stop when the cells leave the breast. And then stage 3 would be a very, very large tumor in the breast, or if the lymph nodes spread to the next level up into the neck area. And stage 4 is when the disease has spread to other parts of the body, so to the lung, to the liver, to the bone.
Right. Now, does treatment change depending on what stage you are?
Yes, so stage again helps you determine what treatment. The earlier the stage, of course, surgery is usually the first treatment.
Okay.
So if you just have a lump in the breast or even have a lump with a couple of lymph nodes in the breast, surgery most likely is going to be your first line of treatment. And then our other types of treatment would include medications, chemotherapy or hormone treatments that are adjunctive to surgery. And even radiation can be utilized depending on how much surgery or how much disease.
Right. Now, what I want to get is this, something that's come up in the news lately, the receptors,
Yes.
cancer markers or gene markers or
Yes.
whatever. Tell me just a little bit. We only have a little bit of time left,
Yes.
but I want to know just a little bit about that.
Sure. So on the microscopic level, when we look at the cancer under the microscope, we can now do a variety of specialized tests where we look for that estrogen sensitivity. So the first important receptor that we find is something called an estrogen receptor, and that is associated with a better prognosis, but also means that you can block estrogen to kill that cancer cell. And we now have medications that will either bind to that receptor and stop the cancer cell from growing or stop the body from producing estrogen, and they're very effective in women who have that receptor, so we look for that. The second newest big receptor is actually a gene mutation. It's called HER2/neu, and it's an amplified gene that some women have and can not only be associated with prognosis, but actually we've developed a new medication. It's an antibody that attacks that gene and can be given along with chemotherapy to women who have that, and it enhances the chemotherapy effect and actually can kill that gene and then kill that cell.
Excellent. Well, thank you very much for coming and explaining this topic to us, because it's so necessary for so many people. Again, thank you very much. We'll have to get you back and to get you to cover another topic, definitely. Thank you very much, Dr.
Thank you,
Coleman.
Dr. Pei, for having me, and
Thank
thank
you.
you to your audience for giving me this opportunity.
Yes, definitely. Well, at this particular point, it's our Let's Talk segment. And today, I would like to cover osteoporosis. And what we're going to know about, what we would like to know, or what I would like to tell you about osteoporosis, is that it's a disease where the bones are thin, and they get thin, and usually it occurs in the elderly. As we get older, our bones get thinner, and they're easier to break. If we fall, and we can break a hip, we can break a leg. And as we get older, mind you, we don't heal quite as quickly as when we were 20. So we want to prevent this. Now, osteoporosis, does it sneak up on you? Yes, it does. It doesn't warn you. You won't know that your bones are thinning. So you must go to your doctor, and he must do different tests and let you know. Alrighty? Is it common? It's very common. 1 in 2 females within their life will have osteoporosis. 1 in 4 males will get osteoporosis. Is it serious? Definitely it's serious, because it's something that can really take an elderly person, a healthy elderly person, and really debilitate them. So we don't want these things to happen. Okay? As far as the risks for osteoporosis, let's just look at this for a minute. Old age, definitely a risk. Being female increases the risk as well. Family history. If you have a family, if your mom or your grandmom had osteoporosis, there's a good chance you may have osteoporosis. Being small or thin, as far as your stature is concerned, may increase the risk of osteoporosis. And your lifestyle, as far as smoking and eating poorly, will increase osteoporosis. Well, it's time for us to go. And in closing, I would like to say, remember, caring and sharing. Email us, guys, and tweet me, www.medmoments.com. Tweet me at medmoments. Remember, never institute any change in your medical therapy before you consult your physician. I trust that each and every one of you have continued good health. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all. Dr. Cohen, thank you very much.